It's
All
really
right.
the first time.
Yeah, thank you so much, everyone, for being on our very first Musana webinar. This is so different for us.
Very different.
I feel like we were just getting the hang of being in person on stage, and now this is like a whole new ball game. But what is really, really exciting is that we have literally people from like all over the United States listening right now, and that like gives me so much energy. Like we have people from New York, we have people from Montana, we have people from Texas, we have people from Canada.
We have people from Uganda joining
Yeah.
in. People just from the neighborhood. Wow, this is really awesome. Yeah, we're just really glad to see everyone. Actually, we are not seeing anyone. So we're just really glad for this technology that we can be together, but not together, but together. Yeah.
Yeah, together, but not together.
Yeah.
So if you don't know us, I'm Andrea, and this is Haril, and we are the co-founders of Musana Community Development Organization. And this webinar is really just about updating you on what's going on in Uganda. So thank you so much for taking the time out of your Tuesday night to be here and to listen in. We really are so glad that you are here. Yeah, so we are actually we live in Uganda full time, and we were in the US actually doing some fundraising for Musana when this whole COVID-19 pandemic started. And we are now stuck in the US in my parents' house. It's pretty chaotic here. We have 3 kids ourselves. We have a 15-year-old, we have a 5-year-old, and we have a 2-year-old in my parents' house. And on top of that, I have an older sister who has a husband and 2 kids, a 5-year-old and a 3-year-old, and they live in Beijing, China, and they are also stuck at my parents' house. So you can imagine we have a very, very full house, and we're only telling you that because I almost guarantee at some point the door behind us is gonna like swing open and one of the kids is gonna be screaming. So just beware, you'll probably hear some background noise.
Right.
And we're sorry about that. So yeah, we've had a really interesting
time here.
Quarantine experience, but it really has been special spending time with family. Yeah, I don't know about Haril.
Yeah, it is a really wonderful time, and I think it's really more fun for my mother-in-law, because even right now we just took over her desk. We are using it, so we have been here. I don't know how many plates, how many glasses we have broken in the house, and she's not super happy about that. And she bought like this bulletproof kind of plates and cups, and I was like, what, bulletproof? So every time I live in America, I just learn more new stuff. Anyways, before we left Uganda, like we were going through this storm, there was a lot going on. My mother was really ill, and she went through surgeries, several surgeries. And right before we left, they had just discharged her from the hospital. And I think it was just within a week or two, and this coronavirus just started exploding everywhere. So before we knew it, we were stuck here. And everyone is back there in Uganda. We miss them. But, because of, again, this awesome technology, we are able to touch base with people and connect with people in Uganda. So it has been really awesome for technology, but we miss people really much. So we are here probably indefinitely. Hope it's not. Yeah.
So anyways, we are going to talk about a few different things. The setup of this call. We're going to start with a little update on Musana pre-COVID-19, just to give you an idea of what's been going on so you can fully understand the impact of it. Haril is going to talk about COVID-19 in Uganda and how it's impacting people in Uganda, the country in general, and Musana in particularly. And then we have a message from our staff. They made a video for you to show you exactly what's going on the ground. And then we also are going to do a Q&A. So again, we're totally new to this. So some of you, I hope, know this better than us, but there should be an a way of answering questions, a Q&A, maybe like thing on the bottom that you can ask whatever questions you may have. And we have Erin Moser. You can probably see her screen on the top. And she's our director of development, and she's going to be facilitating the Q&A. So when that time comes, her face will pop up on the screen. So yeah, we're going to jump into what we have to share. Before we get into anything, I want to first take a minute to just recognize that we know everyone right now is suffering in some way, maybe economically, maybe they have a loved one that is sick. We recognize globally the world is in pain and people are struggling, and we just want to share with you how our little corner of the world in Uganda is struggling right now, in particularly, especially Musana, our community, our people, the people we love, and that by no means belittles what you guys are going through. If anything, we hope that this call will unite us and connect us and help us understand that we live in a global world, and you know, global village, and we're all in this together. So with that, I am going to try and screen share. Again, we're new to this, so give us some patience.
Oh.
There we go. Yeah, so I'm seeing some like totally new people to Musana that have joined this webinar, and that is awesome. You're welcome. So with that, I want to give a little brief intro to Musana. I promise it'll just be very, very quick. Musana is unique in the nature of how we operate. We say we're more than a charity, we are a sustainable solution. So what we do is we build social enterprises in the areas of education, healthcare, and skill and economic development. And probably the thing we're the most known for is sustainability. So all of our operations on the ground in Uganda are supported by income that is generated locally. And what that means is that when we receive funds from the US, we are able to use them to build capital infrastructure for expansion and new projects. And for 12 years, we've been building this model of sustainability and local ownership and building the full capacity of people. And we have never looked at really relief situations. We've been all about rehabilitation and development. And so, you know, actually when this whole COVID-19 pandemic started happening here in the US, we were a bit relieved because we were like, well, thank goodness all of our operations are supported with Uganda income, because we don't really have to worry about, you know, losing supporters in the US that would impact our programs. And then it hit Uganda and it hit Africa, and everything changed for us. We've had to really take a pause at our goal of sustainability and prioritize the needs of our people and really looking at relief. And to be honest, it's been very humbling for us because 2019 was our best year yet, I would say. Our growth, the number of people being impacted by our programs, our sustainability, everything felt like it was just really on track. And 2020 was like this, it started out such this like great year for us. And that's why this has been a really hard season, like it is for so many of you.
Right.
So I want to just talk a little bit about where Musana was pre-COVID-19. So with education, Musana now has 3 primary schools operating. And within those primary schools, we have 2,400 students going to school. These kids are getting the best education in the community. I mean, kids from all over the country are coming to access our quality and affordable services. We have Musana Vocational High School, and every year more and more students are coming. This year we have 920 students at our high school. They're receiving an education that very few high school students in Uganda can get. They have access to technology and IT. And one of the most unique things is we combine the curriculum with vocational skills training. So every one of our students is trained in a trade skill, like
they are doing electrical, plumbing, tailoring, bricklaying, and constructions, and these are skills they will have within the 4 years of high school when they're there, and then go out with a skill.
Yeah. The other thing that we've been doing from the beginning, well, not the beginning, for a long time, is training women in skills. And we actually this year have formalized our training program. And now we can say that we are a vocational school for women. And it's called Musana Empowerment Center. This is our latest graduating class. You can see how happy they are to be graduating. This is our current intake. It's about 120 students that are, these are women, I would say vulnerable women from the community that are coming to learn a skill. They learn, again, tailoring, hairdressing, cosmetology, things like that. And on top of that, they get a business skill. We also this year opened a salon. So it's open to the community. Anybody can come. I was getting a lot of manicures and pedicures, and the ladies get to practice what they've been learning on community members. So in total, with all of our schools, we now have 3,500 students. And in 2019 ended, we had 2,000 students. So you can imagine the jump, the growth from 2019 to 2020 in our schools. Our health center has equally been growing, providing modern, affordable, quality, and compassionate care to the community. In 2019, we provided health services to 45,000 people. We opened the hospital in 2016, and we provided about 10,000 people services. So you can see the growth year after year. I know 2020 equally would have been a year of growth. Soulview is our bar and restaurant. Again, 2019 was a great year. It was actually voted the best department by all of our Uganda team on the ground because it had improved so much, the service, food delivery, and profitability. Our guest house in 2019, we hosted 277 visitors at our guest house. And on top of that, 50 organizations that came to learn about Musana's development model. And that's something we are really passionate about because we see it as a form of scaling or replicating our model by other organizations coming to learn. We currently have 383 full-time employees at Musana. In 2019, we ended with just 282 employees. So literally in the last few months, we have increased our staff by 100 full-time employees. In addition to that, we have 150 part-time employees. Our outreach department is what we call the heart and soul of Musana. And the main component of our outreach department is our scholarships. And we, in 2020, were able to bring in a huge number of new scholarship kids. And today we have 1,258 kids that are coming from some of the poorest families in the community that are receiving some form of a scholarship from Musana. And that can vary, it has different levels, all the way from full scholarship to partial scholarships. So 2018, we hit this point of being 100% sustainable. So I already talked about that. And we came up with this vision 2020. Like I said, 2020 was supposed to be a really big year for us. And in August, we had a big event, Taste to Transform, here in Colorado. And people showed up in big ways. And we raised enough money to begin our first replication of Musana in a new community. And so we went back in October and we started to build a new nursery and primary school in Kaliro district, which is about 30 kilometers north of Uganda. And these are photos of all the buildings that were built from the end of October through the first week of February. You can see it's still kind of a work in progress, and throughout 2020, the plan has been to continue to build until it's a completed school. But the first week of February, we were able to open the doors. And how many were we expecting?
So we're expecting about 150 or 200 students. And this was really overwhelming to see that we had more than almost 700 kids showed up for school.
Yeah. So now 700 kids in Kaliro are going to school at Musana, and that is so exciting to us. Another huge thing that happened in the end of 2019 is we partnered with an organization called Uganda Orphans Fund, and I know some of them are on this call.
Right.
We love you. So Uganda Orphans Fund has been operating a school in Kamuli district, and we have had a huge heart for Kamuli for a long time. We've talked about it being one of the places that we replicate Musana. And Uganda Orphans Fund has actually handed over all of their property, their buildings, their land, their vehicles, everything to Musana. And we have taken on the 150 of their kids, I think all of their kids, that are now going to school at Musana. We've closed the school in Kamuli, and we have been planning to restructure, reconstruct and replan to build a new school with a brand of Musana and starting in 2021. So this trip was starting out as, we were gonna share these big visions and plans. And now, like I said, everything has kind of come to a halt for us. Uganda has been shaken pretty badly by COVID-19, and right now everything we do other than our hospital really is closed. And for the nearby future, we don't know what the plan is. So Haril is going to talk more about COVID-19 and what's going on in Uganda.
Yeah, like Andrea has actually, given us a recap of how things looked like before we left Uganda, before COVID-19. And actually, I think you would relate to this. A lot of you are going through similar situation. The world is different from the way we know it. Our communities are different from the way we know them. We are like living a new norm or a new way of living. It's a new world completely. And so many of you know what's going on around your community, around your country, but you may not know what is happening around the world. And for us here, we want to share about Uganda. We want to share about the community around Musana, what is happening there. Because this is your family, these are your friends, and we are just very glad that we can be able to share with you what is going on the ground. So to start with, Uganda received its first coronavirus test on March 20th. That's when they found the first person who had coronavirus. So right now, they have tested more than 5,000 people in the country, and only 54 have had a positive sign of coronavirus, or they have tested positive. And out of the 54, 7 have been discharged actually from the hospital after recovering and testing negative. So they have gone back to the community, and the government is trying to see that how that really turns out to be. So 47 remain under care in the hospital, and the country is right now on a lockdown for at least for the last 3 weeks. The country has been on a lockdown, and there has not been any registered death right now in the country, which is good because all over the world, people are struggling and people are dying. They have put really strict measures to see that they slow down the spread of coronavirus. And some of these measures have been closing the borders, because most of the people that were coming into the country, or most of these cases, were people coming back into the country from different countries. They came back with the virus. Only 5 people were found from the community without, with testing, that had contacted and got to be positive. and 2 cases actually were found in Uganda, the community we are in. So the restrictions have been so many, but we'll share with you just some of them. And that includes closing down all institutions, all businesses. So basically everything is closed down in Uganda, only essential services to say they have left the hospitals to operate, food vendors because people need to buy food. Those are the places, those are the people that they have left to operate their businesses or to operate, to give services to people. They have also put a ban on transportation. So private transportation, public transportation is all halted. It's all on, they stopped it. No one is moving unless they are walking to go somewhere and in small numbers like it is everywhere else. And even bicycles, because so many people have some bicycles to ride, and people were riding bicycles. They found some carrying another person. So they said no one should be riding a bicycle from 2 p.m. onwards. So just from 7 a.m. to 2 p.m., that's when you can ride your bicycle. Exercising, people had started exercising in small groups. They found that this could increase the spread of the virus. So people were stopped from exercising. Everyone was told, if you want to exercise, exercise inside your house or around your compound.
So even if I want to go on a run outside by myself,
so I mean, those are some of the things here we are lucky of, that you can go out and exercise, you can drive, and but that's not happening in Uganda. They are not allowed to do that. There is no groups for more than 5, and if you're found in groups, it's more than a case of murder, because it's like a war. The government is being very strict on these measures, and if you're fined breaking them, the outcomes are not very, very good. There is curfew, police and army are all over the street, making sure that people are in their house by 7 p.m. and not to move until 6 in the morning. So that's how these restrictions have helped to slow down the curve. Actually, according to what is happening now and what we hear and see on the news, it has really slowed down the spread of coronavirus in Uganda. But however, there is effects that are coming out of this. Even Musana has been impacted. Before I talk about the problems, like Andrea said, we have closed our schools. 3,500 kids have gone back home unprepared. All our staff were sent home unprepared. You can imagine that situation. And so many of your programs were stopped, suddenly. And the problems in Uganda right now, the first problem I want to talk about is food insecurity. We know that, most people in a country like Uganda are living in poverty, and most of them are running small businesses for their survival. They go to work every day to find what to eat, earn little income, and that's what they use on that very day to feed their families. So many people already are going hungry. They're lacking food in their homes and some of the essential things like soap. So where we see people going hungry, we are seeing people becoming now desperate. And after being desperate, there is insecurity and crime that comes into play. And this will lead even to loss of life. So how Musana is trying to come in to respond on some of these issues, like Andrea said, that we are now responding to relief. We are trying to see that we can provide food to the vulnerable families in Uganda. And our target is to reach 1,000 people in the community. Because we know if we can be able to give food to 1,000 people, that will take them through a month, there is about 7,000 lives that will be having a food in their stomach, something to eat in their stomach during this crisis, during these hard periods. And our team on ground is working so hard. I think right now they have given to more than 300 people food, and they are continuing to do that in Uganda. The other thing that I really want to talk about is the lack of access to health facilities. Because of the ban on transportation, no public transportation or private transportation. So people are actually struggling to go to the health facilities. they're struggling to go to hospitals. And right now, there are so many cases. And one of the cases that is happening in Uganda is a mother that died because there was no access to hospital. And we have a video that we want to share with you. We are asking you to just plug in and listen in to this video to see the struggle of lack of transport in Uganda, what is causing to families like this one.
When Scovia Nakawuya went into labour, she struggled towards hospital on foot, crumpling in pain from her contractions. Her unborn child died en route, and so did she the following day. According to a human rights group, she's just one of 7 pregnant women in Uganda who have died after they were unable to reach a hospital because of the country's strict lockdown, designed to slow the spread of the new coronavirus. We spoke to her husband, Francis Kibenge.
My wife tried to find transportation, but they all refused to give her a ride. No one would move. There was transportation, but the government directives suspended transportation for both the sick and healthy. Those directives have affected people so much, and some of us have ended up losing our loved ones. I'm now a widower, and I don't know what I will do.
Ugandan authorities have forbidden any form of private transportation without authorization. Even medical emergencies are not exempt. But Uganda has very few public ambulances, and only 1 or 2 officials in each of Uganda's 134 districts can authorize a journey. Nakawuya's family had no idea who to call as she writhed in pain, leaving little choice but to try and do the journey on foot, trying and failing to hitch a ride. The Ministry of Health said it was investigating the reports and could not yet comment.
My spouse is gone. I must now look after these children and don't even know what to say to them, because what was meant to be smooth became very difficult. If only I had the means to take my wife to the hospital that we both had confidence in, maybe she wouldn't have died. She wouldn't have died.
The women's pro bono legal group told Reuters that of the 7 known women who died, 2 infants were also lost, including Nakawuya's. As of Thursday afternoon, Uganda had recorded 53 cases of coronavirus infections and no deaths.
Yeah, I think you can all see the situation that we are talking about. Just imagine if people can die just lack of transportation. Because in Uganda, we have what we call border borders, motorcycles to help people go to the hospital or to move around. But there was nothing to help that woman to move. So we lost 2 lives, a mother and a child, because of lack of transportation. And this is how we are coming in as Musana to see that we can be there for people, for vulnerable families like these ones, to support them during this hard time. We are providing free transportation to help people reach the hospital and get healthcare services. We have contacted all our patients. We are providing transportation to all our mothers that are due to deliver during these hard times. So our vehicles, our vans are just ready to pick them up to the hospital and then take them back to their homes. Of course, we have worked with government officials and got permission and allowance to move around and pick people and bring them to the hospital. And we are doing it for free. So we are just humbled that we can be able to do that. Our doctors are on telephones, checking in with patients because we have a record of all our patients at the hospital. So they are checking in with everyone and asking them if they know anyone who has a struggle so that we can go in and support. Yeah, so the other thing I actually want to point out, which is the problem number 3 that we are seeing in the community right now, and this is something that is actually going to continue for a long time, is unemployment. So we see that so many people, even in the communities that we serve in, we live in, are just small business owners running just small businesses. And even those who have a little bit bigger businesses and they're employing people, they're already laying off people. And they will not even survive in case even things go back to normal. because of the damage that is going to be caused for about 2 months of a lockdown, and even probably more. So we can see a lot of outcomes of unemployment, and we are thinking so much, how can we continue to support our 383 staff, people that we live with, work with, that are our family at Musana. And we know one staff at Musana takes care of more than 5 people at home. So in this crisis, I'm sure they are all taking care of other people that have lost employment, or they are not even getting anything to eat right now. So what are we, how are we being able to handle this? So as Musana, we have what we call COVID-19 Relief Fund. And this is a fund where we are raising money to support people during this crisis, to provide food for families, provide free transport for people who are in need of healthcare service, and also to be able to keep our staff on a payroll to support their families and people around their communities. Just in case you have a question or an inquiry of the COVID-19 Relief Fund, feel free to reach us out on the email or on our website. You can check out our website and you'll find a link to COVID-19 Relief Fund. And
maybe one thing to add on to that is in our every food package, so is providing a family of 7 people food for a month. And that the total cost of that is $30. That means for $1 a day, you're feeding a family of 7 people.
Right.
So the money goes really, really far. I just think that's an important thing to note and to know.
That's very key. That's very key to know. And right now we are going to share with you a video of our staff in Uganda, just for you to hear their voices. They are on the ground trying to support one another during this time. So we just want you to plug in to listen in to this video and hear most of the voices and the leaders that are on ground right now, because some of you might be wondering, we are in the States, who is on ground, trying to take care of the community that we serve. But our awesome staff are there, and we have a video to share with you. So plug in and listen in to the video.
Okay, hold on. Sorry. Technical difficulty. Okay, here we go. No, that's not what we want. Hold on, sorry. That's the wrong one. Okay, here we go.
My name is Mike Narugoda, the principal of Musana schools here in Iganga, Uganda. It's now 2 weeks ever since the schools in Uganda were closed down due to the COVID-19 pandemic that befell us actually worldwide. But here in Uganda, schools were closed 2 weeks back. Right now, movements were cut off in the country. The kids are in their homes. And just as you can see, this is the main campus. This is the yard where kids rest from. And at such a time, the kids would be flooded all over. And at the moment, there's nobody. The school is quiet, just as you can see. This is our dining hall where our children used to enjoy their meals. The place is quiet. The other extreme end, that is the kitchen. The challenges that we are facing right now as a country. In Uganda currently, we have, they have registered 53 cases of those who are positive with the coronavirus, and they have tested over 3,800, and many are still being tested. So we know this pandemic has affected the whole world. It has affected you people that way. It has affected us here. But right now, here we are. Survival in Uganda here and in Uganda in particular is really hard. So feeding has been a challenge really greatly, and our people out there, our communities are surviving only on a meal a day, and this has made it hard. So we got news about the support that you people gave us, and I'm telling you, we are excited. We thank God for you people. We are praying with you. We are extremely grateful for the support that you have sent us. As I speak now, they are right now packing food items for our staff, for our people, for the vulnerable kids that Musana is supporting. And I tell you, right now, it has raised a lot of excitement, there is a lot of hope, because we are now sure this food is going to push us to at least some time, and that is great. We thank God for you people, and we appreciate the support that you are really giving us. We really thank you, and we are happy, and we are praying that God sees us through this pandemic that has befallen us. Thank you so much.
Hello, my name is Susan Akono. I head the administration here at Musana Community Development Organization. Musana has got enterprises, and right now we are at one of them, which is Musana Vocational High School. It is over 3 weeks ago since the government shut down all schools, but before our students were sent home, the staff, the teachers, the principal together with her team, they made an effort to make sure that our students were sensitized on ways of prevention in order to protect themselves from catching this virus. So the students are home right now, and we are hopeful that very soon schools will be open. Musana is reaching out to over 920 young people that come for school here at this institution. And unfortunately, right now, they are not able to come to school because of the impact of COVID-19. We are so hopeful that these are the future of our nation. They are the people that are going to transform the world over. The children, the young people that Musana is educating. Thank you so much for your support. Keep safe, stay safe. I'm doing my best. How about you?
My name is Kanyago Annette. I head Musana Empowerment Center. I'm just here to inform you about the negative effects that our training of Musana Empowerment Center has gone through due to COVID-19. Our president gave directives that schools and institutions should be closed. We had to send our students back. It's now 3 weeks. Sometimes when students go back, they tend to forget the basics, the few things they had learned. So that means we'll have to go back and teach them again. It has also affected our production, and when we retained 2 staff to help us make masks, we realized that our health center and some few people needed these masks due to COVID, that they may be safe. So we retained 2 young ladies who are supporting us, who are helping us in making these masks, and we distribute these masks to our health center to help them that they can use them to protect themselves. Otherwise, we ask you to pray together with us, to stand together with us in this trying moment, and we believe together we can.
Our members of staff are committed to this cause of having services delivered despite the COVID season, but we face challenges on a daily. For instance, insufficiency of protective wear. We were at one point can run out. For now, we are well covered. And then we have still patients who would come in and are asymptomatic of these symptoms, but we still want to be ready at all times to receive these patients, who we then can forward to the government health facilities to have them quarantined and treated if they are confirmed to have COVID-19. Then we have transportation of patients brought to the facility, who are brought in when they need to by our vans that are acting as ambulances, and we are ready to handle emergencies or whatsoever. by our doctors who are around 24/7 to handle any of these cases. And we are so glad that we have people that are praying for us, are supporting us to see that we continue to have people living in such desperate times.
My name is Mugabi Isaac. I'm the procurement and the sales officer in Musana Community Development Organization. Right now, I'm standing in a place where we have paid the products that we're intending to distribute to different beneficiaries who have been severely affected by the impact of coronavirus. These items include both food and non-food items that we are going to distribute those categories of people. And our plan is meeting 1,000 families or homes that we are intending to support with these food items so that they can cope up with the situation. Among the items that we are intending to distribute, they include maize flour, and they also include salt, they include soap, they include beans, they also include sugar so that they can be able to cope up with the situation. I would like to thank you for your great support that you've done towards Musana, for remembering the people of Musana. We appreciate you for that generous heart that you've been able to provide and see that someone is able to stay for the next day. Therefore, we say thank you.
My name is Moses Okipi, and I head the Social Works and Outreach Department of Musana Community Development Organization. At the wake of COVID-19 outbreak, the department is privileged to coordinate the distribution of food aid items that you have contributed to the targeted number of beneficiaries. So far, we have distributed over 100 packages, and the idea is to reach out to 1,000 households. The whole exercise has generated a line of excitement, and we are very grateful to you for this. On behalf of Musana Community Development Organization, we want to thank you for your generous support towards this initiative. Thank you so much. Thank you so much.
Thank you. Thank you so much.
Thank you.
Thank you.
Yeah, like they said, thank you. We also say thank you for the support, for being there, even in this crazy moment that you can reach out to people in Uganda. So thank you so much. And
yeah, so really quick, I know this is a question that is going to come up. What's ahead for Musana? What's ahead for Uganda, for the community, for us personally? As of today, the President Museveni, the president of Uganda, gave a speech, and he just extended the lockdown for another 3 weeks. So at least for the next 3 weeks, we know the country will be on lockdown, meaning our schools and programs other than our hospital will be closed down. All the issues that Haril already talked about will continue and probably will worsen, which is a really hard thing for us to hear, because we know the suffering and the pain that it's going to cause so many people in Uganda. However, we also recognize that it's a very necessary step, and we are very appreciative that the government has come in with these strict measures. This is a slide. You can see a news story about how there's a lot of fear of what could happen if this starts to spread in Africa. So the reason for this is because of the lack of capacity of most African nations to handle something like a spread of COVID-19. So in Uganda, just to give you a picture of what the healthcare system looks like, Uganda is a country with 44 million people, with a total of 55 ICU beds. 20 of these ICU beds have no ventilator capacity. Uganda, in comparison to the US, Uganda has less than 0.1 ICU beds per 100,000 people. In the US, it's 34.7 ICU beds to 100,000 people. So you can see the shortage. On top of that, most of these beds, or all of these beds, are in urban settings. So the main city, Kampala, is where the majority of them are. And it's really hard for people from rural settings to access them. Actually, they say that it can take a week's wages for someone to transport themselves from a rural village to the main hospital. And that's when there is transport. What the Uganda government spends on healthcare is one of the lowest in the world. The World Bank estimates that per capita spending on health is 6% of the GDP. That's 1/3 of what it is in the US. And then lastly, social distancing is very hard in Uganda. As you can imagine, 44 million people in a space the size of Oregon. Uganda is the same size as Oregon, which has about 4 million people. It's very, very congested, very populated, and people live, a lot of people in a home, 7 to 10 people in maybe a 1 or 2 room home. So it's very hard for people to practice social distancing. And for all these reasons, it's so necessary for Uganda to take these necessary restrictions like the lockdown. However, it's hard. I mean, for us personally, I mean, right now we're away from, our family, our friends, our community, and we don't know when we'll be back. And there's a really high, it's very likely that very many people will begin to go into starvation in Uganda, and that's really hard. So one thing we're doing as Musana is making sure that the people we love, our Musana family, our beneficiaries, our community, are supported. And so much of that has been because of the amazing generosity of people here that have come in and given a hand. So, yeah, do you have anything you want to add?
Not really, apart from saying that, people are praying for everyone around the world, in Africa, most especially even here, our friends and partners of Musana. So our staff in Uganda and here, they are praying for you. And if in case you have any prayer requests, feel free to reach out to any of us, and we'll be praying together, because this is a situation that we are all in together, and we are all struggling in different ways. So, and that's the least we can do, at least for now, to pray for each other in this situation. Yeah.
So Erin Moser is going to pop up on your screen. She should. And then she'll start facilitating questions. So if you have any questions, please ask. We'd love to answer them or attempt to answer them. No promises, but go for it, Erin.
Okay, well, thank you, Andrea and Haril, for just enlightening us. And like you said, Haril, we're all in this together. So it's just nice to see the support that we've got around Musana right now. I'm going to start with, let's see, Michelle had asked, can she get a copy of the video of the mother in labor to share so she can fundraise for Musana's medical transportation efforts?
Yes, Michelle, I will email you the link to the article. We can also figure out a way of maybe putting it on our website so anyone else can access it. It's one story of many. I mean, if you just do a Google search of Uganda and coronavirus, you'll come across a number of stories of how this is impacting people. But obviously that one is very touching, and it's why we picked it, because it sends, I think, a clear message of kind of the suffering that is happening.
Absolutely. Okay. Cameron wants to know where he can get a Musana face mask.
Great question.
It is a really great question, Cameron. What we can do, we can figure out, because the borders are locked down. I don't know if a face mask is allowed to travel, but we don't have any in the US, so we have made them in Uganda, and basically to support, like you saw, Dr. Jesse was running short of some of the supplies, and some of that is masks, and we made a ton of masks for people in the community, because Ugandan people are very communal. They live together really close to each other. And one of the other things we did is to make those masks so that everyone can get a chance to protect themselves, but we don't have any in the US right now. So,
but as soon as we can get you one, Cameron, we will send it to you. And the other thing, it is something that we will probably from now on be producing. And we even got an email today from someone that wants us to start mass producing them for sale along with scrubs. So that's also something we will probably look into, because it gives a really good opportunity for employment to our women.
Right.
And a lot of our women do have sewing machines at home, so it's easy for them to work from home, so we don't have to be bringing them to Musana. So
but
great
Cameron,
question.
I love them too. They're really,
at least you can be stylish when you have to wear something covering your mouth.
Yeah.
Okay, Christopher he asked, how could we help Musana and the people of Uganda?
Yeah, that's a great question. I mean, really, there's two ways. One, prayer. I mean, we are firm believers in the power of prayer, and the people in Uganda definitely need your prayers. The second thing is our COVID-19 relief fund, which we've talked about. That fund will only be used to help us address the three things that we've been talking about. So 1, food packages, 2, transportation to and from the hospital, which is actually really pricey because you can imagine the number of patients going back and forth, and then payroll. And I did see, I think someone asked about how much our payroll is, and right now it's about $58,000 a month, and without any income coming in Uganda, that's money that we are going to have to figure out how to raise here. So yeah, to answer your question, those are, I would say, the main things. And obviously spread the word. I mean, we live in a global community, and I think it's important that we all acknowledge each other, acknowledge what's going on around us. I've really, really appreciated, honestly, our community in Uganda, because it hit here first and they all knew we were here. And I mean, almost every day I was getting encouraging messages and, people just saying, oh, we're praying for you. And, I think that we just have to recognize that this is a global crisis and we're all in this together, and let's share the stories of what's happening.
Yeah.
Absolutely. Okay, Tracy says the Musana COVID-19 relief budget was assuming a 1-month shutdown. It has now been extended to a 1 and 1.5 months for now, right? Are you changing your budget goals for the relief fund, and how is the fundraising going so far? So a lot of questions around fundraising. We also had a couple of people ask about what it costs per month to maintain payrolls. So if you can just talk a little more about that.
Yeah. So with payroll, hospital transport, and feeding, it's about $90,000 US, if I'm doing the math right, per month. So that was kind of our target, and we raised about 80% of that to get through the first month. And like Tracy, you said, now we are. I mean, it was literally just today that we found out about the extension of 3 more weeks.
Right.
So we now will put together another budget, and probably, I don't know if we'll send another email out or something with the new needs. Like I said, payroll is about $58,000 a month to pay all 383 people on our staff. And again, that's something we've had a lot of conversations back and forth. I'm sure so many of you have as well, about, do we look at having our people take pay cuts? Do we look at laying people off? And right now that's something we really want to avoid, because we know how many people they support. And so by paying our staff, it's actually a really, really good way of making sure that people in the community aren't going hungry and that there's not bigger issues caused. So yeah, that's kind of a commitment we have right now. We need to kind of extend it through at least the next 3 weeks, the next month. So yeah.
Okay. And just on the tail end of that, Travis asked, are we directing people to the Musana website to make donations, or is there a separate link for donating to the COVID Relief Fund?
So we have it set up, thank you technology, but as soon as you go to our website, I'm pretty sure a COVID relief, I don't know what you call it, thing will come down, and you'll see it right away, the COVID Relief Fund. And then you can just click on that and it'll take you to a page where you can give.
Scott asks, how often under normal conditions are you able to host a visitor who wants to come and see your operations? We've supported you for a few years, but would like to visit at some point to get a firsthand perspective.
Yeah, I mean, we love visitors, and we love people to come and see. You know, we're a little different, I think, from the traditional maybe mission trip or volunteer trip model. We really encourage come and see, come and learn, come and encourage, and see what the local team on the ground is doing. So we run trips at least a couple times a year. We offer come and see trips as Musana. We also have church partners that bring trips. So if you're plugged into one of our church partners, they bring a number of trips. So obviously right now we've had to cancel all of our summer trips and early fall trips. And right now we're just holding on to the late fall trips, praying that they happen. But, you know, it might be that we have to cancel all of our 2020 trips and look forward to 2021. Yeah, but we love visitors. It's just a matter of signing up for our newsletters and seeing when trips come up. So, and we also have like internship opportunities for people that are interested in being a part of Musana more long term. Again, that'll probably be next summer, 2021. So yeah, those are some opportunities.
Okay, good information. Cheryl wants to know regarding the health center, how is the staff doing? Have they seen any COVID-19 cases, and how can we support them? Is there any messages, funding, equipment, etc., that we can help out with?
Generally, the staff are doing fine. We are supporting them in the best way we can because they are at the front line in this situation. So they are going to work. They are provided with the protective gears they need to work at a workplace. We are supporting them, and right now the prayers would do much. And if in case I'm not sure I could be in touch with some of them, I mean checking in with them, that would be great.
Sending them encouragement.
Yeah, sending them encouraging messages or prayer. That would be really great because they are working really hard and they have a lot of support around them right now because it's one of the departments that is working. They haven't seen any patient come in testing positive. So what is happening right now, if anyone comes in with symptoms of COVID-19, they are referred to the government facility, which in return will refer them to a hospital in Entebbe, which is outside Kampala. And that's the only place where they're doing tests for COVID-19. So at our facility, we have not really had anyone come in with such symptoms, which is good. There were only 2 cases and they were identified very early on. And it was a child and a father, and they were taken to Entebbe. So there hasn't been really, that much. And they are still seeing patients, but they haven't really intervened with the patients with symptoms of COVID-19.
Okay, good, thank you. I know we're getting close to the end. I'm gonna ask one last question. And I'm also just gonna answer one real quick. Everybody keeps asking, when and where will this video of this webinar be available? So we are recording it and we will put that on all of our social media platforms as far as Instagram, Facebook, and whatnot. We'll have it on there and you'll be able to share it. So please do. We really would encourage you to do that. The other question is, what is happening to the events for 2020 here in the US, the fundraising events?
Oh, yeah. Another kind of sad question. We had a big golf tournament planned for June 1st, and obviously that's not happening. So we've gone ahead and canceled that. Our next event is October 3rd, and that's Taste to Transform, the one I talked about earlier, and that's kind of our annual event. And right now we don't know. I mean, right now we're keeping it on and praying that it happens, but we know that it's possible that there'll still be some social distancing restrictions, and then we'll have to be really creative. Aaron, you have to put your creative mind into work to see how else we can do an event and keep people connected. So
sorry, I'm going to ask one last question because I think everybody wants to know, and then you can wrap it up. Will you be able to go home once the Ugandan lockdown is lifted?
I mean, the second we can buy a plane ticket, the second the borders open and we can get there, we'll be there. Even if we have to quarantine in a hotel for however many days with toddlers.
Yeah, that would be hard, but we would love to go back even now.
But honestly, we're not holding our breath. I mean, we've kind of accepted that it could be a while before the borders open up, and we respect that. I mean, it's in a country like Uganda, we appreciate the restrictions, and we wish we were on the other end of it, but you know, God has us here and we're making the best of it.
Thank you guys. Thank you for answering all these questions. There's a few more on here, but we can always answer those. And someone else asking about the social media post. We will get you a social media post, Cheryl. Okay. So if you guys want to, wrap it up, thank you guys all for joining, and yeah, we appreciate you.
Yeah, so thank you everybody for listening. First of all, we appreciate you taking the time to listen, and we are available. Just if you have any more questions or thoughts or input or advice or anything, just shoot us an email. We'd be happy to hear from you. We thought that it was fitting to end with a music video that was made by our staff. So we have a security guard on staff named Bosco, and he wrote this song about Musana. And so a lot of you may have seen this video, but we love it, and it's positive, and we thought it was a good way of ending the night. So you can go to bed when you have some reggae tune going on in your head. So Haril, do you want to say anything before I play the video? So I'm going to play the video, and then I'm going to close the meeting or close the session. So that will be the end of it when the video ends. So thank you again for listening.
Yeah, thank you so much for taking the time and listening in.
All right, here we go. Let's see if I can do it. Oh, wrong video. Sorry. Oh, shoot. Okay. Okay, here we go.
Musana shine is a better place I've ever realized. Musana shine, you're the best home I've ever realized. Cause you give us freedom, care, love, and wisdom. Now we look in culture, stronger and hardy working. Yeah, now we the one love, one heart, let's fight forever. Lift our hands, so let's fight together. Giving out the man of Africa, we love Musana. Never leave Musana, never, never, never. Shine to me, Musana. Shine to me, Musana. It's a place to live in, beautiful environment. Shining to me, Musana. Shine to me, Musana. Shine to me, Musana. It's a place to live in, beautiful environment. Shining to me, Musana. Nice, beautiful home. I can never live without Musana. Love, happiness, and joy. Musana's got the beautiful people. I feel so proud. Through empowerment, development, and transformation. Skilling Uganda for self-reliance. Integrity deep into change the nation. Now we do one love, one God, let's fight forever. Lift our hands, so let's fight together. Giving all the ball of Africa, we love Musana. Never leave Musana. Never, never, never. Shine to me, Musana. Shine to me, Musana. It's a place to live in, beautiful environment. Shining to me, Musana. Shine to me, Musana. Shine to me, Musana. It's a place to live in, beautiful environment. Shining to me, Musana. Musana shine is a better place I've ever realized. Musana shine, you're the best home I've ever realized. Oh. Nice, beautiful home. I can never live without Musana. Love, happiness, and joy. Musana's got the beautiful people. Now we be one love, one God, let's fight forever. Lift our hands, so let's fight together. Giving all the ball of Africa, we love Musana. Never leave Musana. Never, never, never. Shine to me, Musana. Shine to me, Musana. It's a place to live in, beautiful environment. Shining to me, Musana. Shine to me, Musana. Shine to me, Musana. It's a place to live in, beautiful environment. Shining to me, Musana. Sunshine.